talking about. Hello, ladies and gentlemen. Thank you very much for joining me today in this live webinar on the subject of learning how to better understand your lab results that you get from the doctor. Not saying that you can't benefit from your doctor's feedback on your lab results. We're going to talk about your complete blood count, metabolic panel, comprehensive metabolic panel, and lipid panel, even maybe thyroid we'll touch upon real quick. But the difference is that for a medical doctor, he's looking at these numbers and he wants to get these numbers down. For example, if you have high LDL, the bad fat, high total cholesterol levels, you're going to want to, he's just thinking steroid. That's all he's thinking, steroid. Put him on a steroid. And I don't think there's enough evidence or proof, or even in the medical community, that steroid is worth the adverse side effects that come with taking a steroid. And we won't get into that, but many medical doctors, many of them are my patients, agree with me and, well, even tell me directly they would personally never take a steroid themselves. So for me, however, when I look at your blood work, your comprehensive metabolic panel, or your your complete blood count, I'm just looking for clues to help me diagnose. So because in Ayurveda, we are already trained in diagnosis. And it's an ancient system, and it was around before people had blood tests. So that's why we were trained to look at the pulse, look at the eyes, look at the skin, look at the tongue, ask a million questions and know everything about the person, including not just everything they eat, but, all their elimination, how much urination, how much defecation and appetite, and all these other things are giving us information where we can come to mostly the similar conclusions. And even we can look at the blood itself, particularly if you poke a person, you see the blood coming out. You can get information from the darkness, the thickness, or how it shapes. And microscopy can look at it through a microscope and even tell you more by looking at the red blood cells. So these are other forms of diagnosis that can help you to, help the doctor or natural doctor, Ayurvedic doctor, to understand all of your health issues, and some without blood work. In fact, in India, they say, blood work is for the amateurs. Of course, this is an Ayurvedic doctor joke, because Ayurvedic doctors are trained much more on diagnosis and don't rely on blood work. But it's not invaluable. It's giving information and clues. But sometimes the ranges that I see as healthy may not be the same ranges that your doctor sees as healthy, because he's looking from a very, rigid or textbook perspective. And those are the kind of examples I would just like to cover today. This is not meant to be a comprehensive course in reading blood work, but just to look at some key points that I find that I look at that are different from the perspective than the medical doctor looks at. Now, if we start with your complete blood count, this is very important, because obviously your blood is essential. And there we have your white blood cell count, your red blood cell count, your platelets, your hemoglobin being the main factors. And white blood cell count is very important. If you have a cold or a flu, or you have an pneumonia, then this is going to be very high. But even if you have some autoimmune conditions, this can be high. Certain symptoms like itching and allergies, we can see high white blood cell count. So that's helpful. And of course, red blood cells are, so important. They're carrying the oxygen everywhere. And if these are low, then your body is having difficulty in producing blood, which is a complex process. And in fact, in Ayurveda, we have a formula called blood builder. And and that's what it's doing, is building the red blood cells and the platelets. Now, platelets are very important. A lot of people don't think about them, But if the platelets get too low, you get a disease called ITP. I forget what it stands for, but it basically means your blood's so thin, you're going to have like internal bleeding, and you could have hemorrhaging in the brain, and you could have a cut that doesn't stop bleeding. You could get bruises. You can see these people with big purple patches all over their body, and that can be from low platelets. It also can be from medication like blood thinners. And unfortunately, medication really mess with your blood work a lot and make it complicated when a person is taking a lot of medication. But again, we have this formula called blood builder, and it's mostly to build up the platelets in your body and to treat this chronic bruising, thin blood, or this very life-threatening condition called ITP, which is considered untreatable unless you know some of these herbs that were taught to me in India to build the platelets. But we just call it blood builder because it's also helping to build more red blood cells. But again, it can have a lot to do with a person's diet. Like I said, the doctor may see a possible disease pathology if he sees red blood cells, but it also can be a lot to do with a person's diet and what they're eating. So unless you're really aware of everything a person's eating, it's hard to say whether it's a cancerous or nutritional deficiency. It can be nutritional deficiency creating these red blood cell, a low blood cell count. It also could be, cancer. So you can't just jump to conclusions on almost any type of blood work. So I think, of course, the white blood cell count is very indicative of your immune system being overactive. And for a person who's healthy, doesn't seem have any signs of even joint pain, but their white blood cell count's high, this is a key indicator of an overactive immune system. And sometimes this can just be from, again, what people are eating. A lot of people are taking a lot of mushrooms and a lot of foods that actually are known to increase your white blood cell count. And sometimes I see these high numbers and the people coming to me with an autoimmune condition and their white blood cell counts through the roof and other inflammatory markers are high, which would indicate maybe an autoimmune condition. There's the rheumatoid factor. But a lot of times it's the people taking stimulants and substances that are overstimulating their own immune system and jacking up their white blood cell count. And so you don't want to have an immune system that's too high either. You get type of allergic reactions, itching, and other symptoms. Another thing that can really mess up the person's blood work is the vitamins. I mean, sometimes you get these blood work and you see these B12 numbers are through the roof, and that's from their own supplements. And we're going to do more webinars on nutritional counseling, going through different new supplements, because people I feel are really taking low grade 1950s to 1970s supplements, synthetic isolated vitamins, particularly B12. If you look at the back of a lot of these vitamins, like a B complex, you can look under B12 and look at the daily percentage provided. And sometimes it's as high as 20 or 30,000% more than the recommended allowance. Now, most people know the daily recommended allowance for many of these nutritional substances is quite low. So it could be, healthy amount would be 200-300% more than daily recommended allowance for, say, B12. But a lot of people are taking supplements with tens of thousands of percent higher. And that's because the supplement company knows you get energy, a rush of energy, and feel good. So to supposedly it's stimulating to put in a lot of B12. So the people take the vitamin, they feel better. They don't take the vitamin, they don't have the energy. But then they're also stimulated. It can create racing heart. It can create even insomnia in some people. So I've looked at blood work and seen these high numbers, and I felt the culprit was over cheap synthetic substances, supplements, particularly B12. Now, if we just go on to your basic metabolic panel where you can see the breakdown of things like calcium and glucose and sodium. Well, glucose is obviously the key one. We're going to talk about it in a minute, how your blood sugar numbers, your glucose numbers, and ultimately your A1C that has a much greater impact, high blood sugar on your cardiovascular system than your lipid panel. I mean, in the past, people all thought, oh, high cholesterol, and then it's been high LDL, the bad fat is the cause of, accumulation in the arteries and blockage, but not so much. It's the high blood sugar is the real the real bad boy here, culprit. And glucose is something everybody should be measuring at home. You shouldn't even be waiting to go to the doctor to measure your glucose level, because now you can buy a little test kit online for $30 and be measuring it yourself. And of course, when you get your blood sugar numbers, your glucose numbers, your A1C, which is more of an average, so there's the fasting glucose in the morning, and the A1C is your kind of the average for a few months. I mean, I would like to see A1C is a little lower at 5. Most doctors are happy with it, even at below 6, but you really want much lower numbers. It's much more important than your lipids panel. I'll be much more relaxed on seeing total cholesterol a little high, even LDL high, HDL low, even though that's the good fat. It's not going to bother me as much. We can improve liver function. We can change diet, and we can adjust all that. You're not going to die of a stroke, from a little high cholesterol. It's kind of an old school thinking. But high blood sugar, we know this is leading to cardiovascular problems and other metabolic problems, and even ultimately kidney problems, failure. So that's where you really should be focusing. If there's anything you should be keeping an eye on, it's your glucose. And there you don't need to go to the doctor. You just buy the glucose tester. Now you can even get patches and hook it to your phone with the Bluetooth and just watch it all day long. So every time you eat that cupcake and you see it shoot through the roof, at least it's kind of giving you a little wake-up call that cupcake is shooting your blood sugar high, which is not just, going to step you closer to diabetes, but, it can cause cardiovascular problem and even kidney problem, even just one high spike into 300s. So glucose is really the most important thing you should be looking at in a basic metabolic panel. There's also sodium. Now, a lot of times when people see sodium a little high, they think, oh my God, I better cut out the salt. But usually I ask the people, how much table salt do you have? How much do you go out? And they say, oh, no, I'm not using much. I just use a little Celtic salt. So then I know, okay, they're not eating out. They're not using a lot. The only reason, it's got to be because they're dehydrated. Then I ask them, are your lips dry? Is your tongue dry? Is your skin dry? They go, yes, yes, yes. So I go, okay, you're not drinking enough water. That's what's pushing up your sodium. So just because you have an indicator like high sodium doesn't mean the person's taking extra salt. Now, if they're eating out, having salty food, then okay, sure. But a lot of times it's just dehydration. And, potassium is also important. And of course, when it's high, we can be concerned that the kidneys aren't working and not getting rid of this waste substance. And calcium, of course, is very important. We know this is so many, even for not just our bones, but our muscles all need calcium and magnesium and the balance between these two. But the problem is a lot of these calcium supplements people take, calcium citrate, calcium carbonate, calcium, there's like a few different types, same with magnesium. They they may jack up these numbers, but they don't necessarily translate into better bones. So that's another thing you have to keep in mind. Is say you see low calcium numbers and you start popping calcium every day, a cheap calcium supplement you bought in supermarket, and now your numbers may be going up because they're just measuring it from your blood, but your bones aren't getting any stronger. I see this all the time because I don't look at the number. I look at the signs and symptoms of degenerative bone condition like weak, brittle nails, hair falling out. These are the signs. Are definitely cracking teeth, or a lot of, our teeth are basically bones. So if you want to see somebody's bones, you can just look at their teeth or ask them if they're having chips or cavities. And this can be, a degenerative bone condition, which if we think in nutritional terms, they're going to need more calcium. And so if you're taking a calcium supplement, but your nails are still brittle, your hair is still falling out, then it is not translating into stronger bones. And that's what the problem with a lot of these synthetic vitamins. They'll change the number for the doctor, so he's happy, calcium numbers higher, but it's not helping you achieve what you want to do, and that is, strengthen your bones in most cases. Now, we look at bicarbonate. That's another number that helps you in your basic metabolic panel to kind of know the pH level of the blood. And BUN, or BUN, I really shouldn't say BUN, blood, urea, nitrogen. This is usually an indicator of kidney condition, but the real important, and you have to look at this number in compared to other numbers like creatine. Now, if creatine number is high, like even higher than 1, I think the doctor will accept it up to like 1.2, but even over 1, in my view, like 1 or 1.1, not good. Because creatine, that's the best indicator you got of your kidney function. So that's where a doctor can be a little slack. Oh, 1.2, you're in range. And I'm thinking, this isn't good. This person's only 30 years old, and we already have creatine going up. And that's really the most important sign of kidney function. It's filtration ability. And of course, other things like potassium would go up, and then also the eGFR. This is like the flow rate through your kidneys. The E means estimate, which they just kind of calculate. It's not a real. They're not making you urinate 5 times a day in a cup and measuring how much water you're drinking, because that would be the only accurate way to figure out this flow rate. So that's why they put the E in front of it. So it means it's estimated. It is calculating this from other numbers. But that GFR rate, we call it, that's the flow through your kidneys. And when your kidneys start to fail, this number starts to come down. And really, you should be in the 90s. Well, there's a lot of people, you could just test it and it's like 100, 99, 98, that's pretty normal. It means it's flowing. There's no blockages. It's flowing through these 2 filters called the kidneys that are removing all these wastes. And generally, when the kidneys aren't working well, we see numbers go up, like the potassium and the BUN. And this shows that the kidneys are not getting the waste out. And of course, this waste accumulates in your body and will just kill you. So that's why the kidneys are so important. But this GFR, that's the flow rate. Now, if you look on your lab work, it will say anything lower than 60. But, I've talked to many medical doctors and they concur even 70s is not good. I mean, it depends on your age too. I mean, the older you are, those kidneys are older, maybe a little bit in 70s isn't too bad. The person's in their 80s, okay, they got a little bit low flow rate, but they're nowhere near going to dialysis, and they're in their 70s. You're not going to be sent to dialysis till you get in your 20s. Then they're going to panic and put you on the dialysis list. But that's why they don't really mind it at 60. But it's not a good sign to even be in the 70s. So I'll start treating this kidney failure, early signs of kidney failure. It could be many causes. It could be crystallizations or kidney stones, or and if the creatine is up too, then we know the kidneys are failing. So you want to treat this in the early stage, because I am treating kidney failure. I don't know anybody else who's getting people off of dialysis in North America. I know Indians are doing it in India, including my own teacher who I learned from. But you don't see many even naturopaths getting people off of dialysis, because you really have to, you have to have a lot of herbs that are very rare and to get, and you have to be a good herbalist, and the diet you follow is completely different than the diet that the doctor gives you, because the doctor just gives you this low potassium diet, and removing potassium doesn't improve your kidney function. It's just that when your kidneys are failing, your body can't get rid of the potassium, so they figure, hey, better not have more potassium. But it doesn't fix anything. It's like reducing sodium for high blood pressure. Sure, high sodium can increase your blood pressure, but just eliminating isn't going to improve your cardiovascular system. So it's important to, notice the difference, with kidney failure. Getting rid of potassium-rich foods like bananas and avocados isn't going to improve your kidneys, and you're still heading right to dialysis. So these herbal treatments are really essential. Nobody can really treat these on their own. They're really quite tricky. And the diet is completely different than what the doctor tells you. But my point is, and it takes years for me to reverse somebody's kidney failure. So when I see the numbers are already going in the wrong direction, I want to start treating it soon, because I know it's going to take me a year to make a big difference here. And a lot of people, unfortunately, by human nature, wait until everything is bad. So I would be worried if my EGFR numbers were in their 70s. And if my patient was in their 70s, I'd be worried. I'd be worried personally if I was in the 80s. But 70s for sure. Doctor's not even going to care at the 60s. He's not going to care until the 50s. And even then, he's not going to do anything except tell you to stop having potassium-rich foods. So it's just going to get worse. And then the people don't do anything, and then because they can't do anything, there's really nothing. There's no treatment for kidney failure except kidney replacement, transplant, or dialysis. And that's where most people end up, is on dialysis when the numbers get below 25. But see, so meanwhile, most of my kidney failure patients, they don't do anything in the 60s because the doctor didn't even tell them about it. And then in the 50s, it just didn't look like it was too bad because it was just under 60, which is acceptable. Then it gets in the 40s, then it gets in the 30s. Now the doctor is telling them, oh, you may have to go to dialysis in the next 6 months. Then they worry. Then they contact me, and now we've got a number like 29. So it's a lot of work to move, the EGFR from the 20s back up to the, 70s again. But it's very easy to take care of it when you're just in the 60s. So that's the difference between my perspective and the doctor's perspective on many of these subjects. But that is the main. Your basic metabolic panel will tell you about your kidney condition, your blood sugar, and any of these electrolyte imbalances. Now, you can get what's called a comprehensive metabolic panel, and that will add more valuable information. You really want to get these tests. I find a lot of people, they go to the doctor, they bring me these tests, or they show me on the app, or they share it on the screen, just take all little screenshots of it, and then they don't even have the comprehensive metabolic panel. And this one can be very important. Not only does it have the total protein, but to me, it has real important liver enzymes like ALT, AST, and of course, bilirubin. And these are very important because if your total cholesterol numbers are high, your LDL is high, you may have fatty liver, then the real question is, well, how's the liver actually doing? Is it still like healthy, or do we just have a lot of extra body fat, bad diet, no exercise going on? And that's where I can go look at this comprehensive panel here, this metabolic panel, and look at these liver enzymes, particularly ALT, which if that number is high, it could be liver cancer. So liver damage, cirrhosis of the liver, hepatitis of the liver. So ALT, if that number is high, it's not good. That's not good. That's serious liver issues. AST, not as bad, but still can be cirrhosis of the liver. Both numbers are high. These are liver enzymes. It's not good. And then, of course, the bilirubin. This one can move the most, even you don't have like liver cancer. Bilirubin, shows that, poor liver function. And this number will come right down by taking liver herbs. That's the beauty of these numbers. When I see those numbers high, I don't have to start asking people more questions about their ability to digest fat. We ask for, just when you have fatty or oily foods, do you feel nauseated? Can you not take fried foods? Do some symptoms like that, signs like that show that the person's having trouble digesting fat and more than likely not making enough bile to break down this fat. So it could be sluggish bile, sluggish gallbladder, gallstones, poor liver function, too much high cholesterol, too much fat in the diet, etc. But if the bilirubin is also high, then we know the liver just is not working well. And of course, the medical world has no treatment for the liver because most medication is damaging the liver. So any medication they give you, like even a steroid, is going to damage your liver and make it worse and create other health problems. And that's exactly what happens when people get on steroids. Well, they'll start affecting their liver, and then your cholesterol numbers start going up, and et cetera. So then you have to take more medication. But if the bilirubin's high, then you're definitely going to be getting liver herbs because it's the only way to get these numbers back down. But the number then is giving me a clear indicator that, oh, the liver, it's not just the person who's a little overweight eating bad food. We've actually got some little bit of liver, I don't want to use the word failure, but poor liver function going on here. And it will all depend on those numbers that you see in the comprehensive metabolic panel. So that's so important. And a lot of people aren't even getting that. Now, I know most people know about the HDL, the good fat, and LDL, the bad fat. That's the high density lipoprotein and the low density lipoprotein. But, and then there's also the total cholesterol, and then there's the triglycerides. One, I don't really concern myself with the total cholesterol. I mean, it's a number I'll look at, but since it's combining all the good cholesterol, the bad cholesterol together, it really doesn't tell you that much unless the number's really high, and then you know there's an issue. But again, you want to go back and look at the comprehensive metabolic panel to see how that liver is actually functioning. But really, this LDL, the bad boys, you don't want this too high, but I would say I would accept it higher than most ranges. See, most of the time you heard me talking about me accepting things not accepting things outside of ranges that doctors would accept it. But when it comes to this, your lipid panel, I tend to be more accepting because some people just have higher levels of cholesterol in their body their entire life, and they're not having any cardiovascular problems, and their liver enzymes are good. Their ability to digest fat's good. So I'll accept it more, particularly if the numbers aren't increasing every 3 months. And this HDL, of course, we want it over a certain level. And that's usually dietary. When we're talking about lipid panel, it's almost 100% dietary, even though we know that our liver is mostly responsible for making most of the cholesterol, not so much the food. That's why you got to change you can't just change your diet to adjust your lipids, to get these good and bad cholesterol numbers in range. You probably have to treat the liver, because the liver's its main job to make most of the cholesterol. Your body's making most of this cholesterol, not even coming from your diet. Now, if you over-restrict yourself, which is what people do, kind of go to the other extreme. Okay, I'm not having anything oily, any more fat, no more ghee, no more oil, no nothing. I'm just, drizzling only olive oil a little bit. Then they can have actually insufficient fat in the diet. And this can create a whole cascade of health problems by over restricting fat. Of course, in nutritional science, fat's an essential nutrient there, carbohydrates, fats, protein, and then fiber we could add on to those, all essential. So mostly you can adjust your lipid panel by changing the diet and taking liver herbs. And you can see we have many different types of liver herbs available. This has to be picked on a case-by-case basis. And if you're looking at the comprehensive metabolic panel and you can see the liver enzymes, it will give me a great indication. And also it gives me something that the client can take the herbs for a few months and then go to get tested again and get back. And then the client sees those numbers coming down and they're more motivated to keep taking the herbs, because most people stop taking the herbs too soon because a lot of their symptoms say they're having trouble digesting fatty and oily food, and you give them the herbs to improve their liver function. Now they're having French fries and they're not having any problems, so they think their liver's fine. But if you look at the blood work, we could still see the lipid panel everything is not in range. But again, I would never be too strict about having your LDL and your HDL always in range. It could be, particularly if you have a long history of them being a little bit out of range. And I wouldn't worry too much about total cholesterol. Triglycerides is what you need to worry about more. This is, of course, the type of, we could say, sugar being carried off to the body. And if that's too high, that could be affecting your blood sugar. And if your glucose is high, plus your triglycerides high, this is not a good sign. I would be much more concerned about the glucose and triglycerides and your lipids, because it's kind of old school that if you have high cholesterol, you're going to get a cardiovascular attack and plaque's going to build up. I mean, this is kind of a little bit old in its thinking. Now they know the high blood sugar is the real cause between a lot of cardiovascular problems. So by having high lipids doesn't mean that you're not really interpreting the condition of your cardiovascular condition. And you always have to look at these things in terms of risk. What's the risk? If there's no risk here, then what's the point to be doing some kind of evasive action? Same with high blood pressure. I mean, some people run high in high blood pressure their whole life in the high 30s, and this is totally normal. They never have any chest pain, never have any symptoms, difficulty breathing. They even do pretty well on EKG machine. They don't get high spikes, and their body just naturally has a higher blood pressure. And of course, in Ayurveda, we look at people individually, and it's this Pitta type of person or Pitta Prakriti person that can tend to have higher blood pressure. So if I say I've got this real Pitta guy, he's all red, he's a little aggressive, he's in the military or he's a police officer, he's got a little bit of aggressive job, he's a and they don't have blockages in their artery, they don't require surgery, and even sometimes they take medication and it still doesn't even come down. That's a sign that that's just who you are. So Vata type people, they do better with higher fats, more cholesterol in the body. Kapha type people, they do better with less fat, less cholesterol in the body. And Pitta types tend to have a little bit higher blood pressure, which is the beauty of Ayurveda. See, we look at people individually, and this blood work doesn't take in consideration your diet, doesn't take in consideration of your body type. Now, if we just move on quickly to like your thyroid panel, where you got your T3, your T4, and your TSH. Here you can see if you have hypothyroid, hyperthyroid, and possibly you can interpret it if you had like Hashimoto's or an autoimmune condition. Now, when you do have like Hashimoto's, usually it starts off like hyperthyroid, overactive thyroid, high T4s, and with high TSH. And then as the thyroid gland is destroyed slowly because of the immune system, then it turns into hypo. And of course, everybody's been misdiagnosing this for years, because you could go to the doctor and you can have these low T4 numbers. They think you have hypothyroidism. And then 5 years later, they go, oh, no, it was Hashimoto's. I guess it was Hashimoto's who figured this out. So we named it after him. So, but there's a big caveat on these numbers. And I get people with low T4 numbers. And, and a medical doctor or Ayurvedic doctor in India told me, cold food, cold drinks, ice cream, ice water will drop these numbers artificially, because, your thyroid gland's right here. It's got a great proximity to your throat. And it is a gland. So, it's the endocrine gland with hormones, which are mostly fat. They're fat-based, not water-based. So when you're drinking cold drinks, cold water, you're even in cold climate, but particularly ice water, that's what my teacher in India told me. People who drink too much ice water will lower their T4 numbers and lower their overall metabolism, and the doctor will just throw them on medication, and the whole cause was ice water. And I've actually been successful in asking people. A lot of times people will have low T4 numbers. The doctor wants to put them on thyroid medication. And I asked them, do you have ice water? Do you have ice cream? And 9 out of 10, they say yes. So, now you're taking a medication because you're having ice water. Maybe it's better to stop the ice water, since Everybody knows ice water is extremely destructive for your digestive system and your overall metabolism, and it's coagulating these hormones in your thyroid, and they're not excreting enough, and then your numbers are low, and the doctor throws you on medication. That's not always the case. There's other causes, but again, we have thyroid herbs that basically for low thyroid are unblocking the thyroid. You could just think of the thyroid as being like a little constipated. It's there. You can have an iodine deficiency, but then you get a little swelling, like a little goiter, and that means you're not getting enough iodine, which is common. But if the iodine numbers are fine, there's no goiter, you got these low numbers, and there's no ice cream and ice water going on, then you could just think of your thyroid as being like a little constipated. It's just clogged up, kind of like a gallbladder. Doesn't mean you chop out your gallbladder just because it's blocked up. You want to clear it. You don't rip out your toilet pipes just because it's clogged. No, you throw in the Drainol and clean it out and don't clog it again. And that's what you need to do for your gallbladder, of course, which is what the herbs do. Gallbladder herbs, they just flush out your gallbladder so you don't have to have it removed. Because that will affect your digestion adversely for the rest of your life, despite what they tell you. It's there for a reason. And same with your thyroid. It gets congested. So why you taking a thyroid, mostly thyroid medicine, is not even a medicine. It's a hormone replacement. You're taking the synthetic version of the hormone your body's supposed to be making. So then you become dependent on it. So I always ask people who are on thyroid medication for hypothyroid, how long have you been on the medication? Because if you just started, it's reversible. If you've been on this medication for 20 years, it's probably unreversible at that point because your thyroid just stopped working because you've been taking the synthetic replacement now for 20 years. So your thyroid's just going to stop. So the thyroid medication isn't even medication. It's hormone replacement therapy, putting something in your body's supposed to do, which is why, a naturopath, they do a lot of hormone replacement, but Ayurvedic doctors would rather fix the problem. That's why we don't advocate melatonin. That's a hormone replacement. You become dependent. Even, sex hormones, estrogen, progesterone, testosterone. The more you take it externally, the less you're going to make it. So in Ayurveda, it's more about stimulating that organ or gland to get going and make the hormone so you're not dependent on taking hormone replacement levels or a medication for the rest of your life. So, there's other type of tests you can get. There's sexually transmitted infection tests. There's cardiac biomarkers. There's other tests we can do. There's inflammatory markers. A C-reactive protein test is very useful for that. But again, you got to look at the bigger picture. If somebody's coming to me with arthritis and joint pain, well, we already know they're inflamed. If you got irritable bowel, even inflammatory uterine condition like endometriosis, we know there's inflammation there. So if you see the blood work and we see these inflammatory markers are high, then we're not surprised. Duh. I mean, you got the joint pain, these inflammatory markers are going to be high. But at the same time, if you see these inflammatory markers high and the person doesn't have joint pain, that's almost more interesting. So, I think it's good to, talk to your medical doctor, see what he has to say. I don't think he gives you that much time, which is a problem. I think it's a little risky going online and Googling too much, but it's helpful. And then, of course, it's good to get a third person's perspective. You do a little research yourself, you listen to the medical doctor, and then you get a third person who's hopefully looking at things a little bit more holistically and looking at these numbers as clues to your health issues or issues with certain organs, because that's really what it comes down to. I don't treat disease. I'm treating organs. I treat your kidneys, treat your liver, treat your gallbladder, even treat your brain, treat your male reproductive system, treat your heart. We're just treating organs and systems in the body. Medical terms are something else. We don't treat medical terms. We treat the organs and the systems in the body. And these blood work can give us indicators for what's happening in these organs. And it can give us indicators to your own diet and even nutritional deficiencies that you have. But when we look at, mineral tests and we look at deficiencies, it doesn't only mean that the person's not getting it. It doesn't definitely mean, oh, she start popping some synthetic vitamins. It could just be malabsorption. It could just be poor digestion. So when I see somebody with poor digestion, gas, bloating, constipation, unable to digest anything, I can't eat wheat, I can't eat dairy, I can't eat anything. Well, those are digestive problems. And then if we look at their blood work and we see there's nutritional issues, we're not surprised. Even they're eating good and you're not digesting well, you're not going to get the nutrients. But just popping a bunch of supplements doesn't fix your digestion. And unfortunately, that's what people do. If you're on your own and you see these numbers are low, like your B12, you may just start popping B12. And of course, for vitamin D, which we really didn't talk about, which is good to test, it's a fat-soluble vitamin. So, it doesn't go up and down real fast like B12 can just up and go really quick. Just like your glucose numbers, I didn't say, you really need to measure it on your own, because say you had something too sweet even the night before, you may not get good numbers even the next morning. And if you cheated a little bit and had an espresso or a coffee on the way to the doctor's, you're just going to whack out your numbers. Even if you ate anything in the morning, besides just like a pure protein like eggs, you're going to whack out your numbers again. So, the number you get from the doctor is only one. You really need to be measuring your glucose on a regular basis. And many of these water-soluble vitamins, like the B vitamins, they can also fluctuate day to day. So it really depends on what you ate the day before. But when it comes to D, too many people are taking synthetic D vitamins when there's food-based D out there. And many people, it was real popular to take 10,000, 20,000 IUs of D, like, just a few years ago, everybody was pushing this, naturopaths mostly. And, there's adverse side effects to taking too much D, and definitely you can get toxicity from too much A, which is what happened to some people who are taking too much cod liver oil. So you can OD on supplements too. And they're not all a cure-all, even for nutritional deficiencies, because you could have digestive problems. So, one more point I'd like to make is that just because all your blood work is in range does not mean you're healthy. That's a very important point. Glad I remembered that. And I have many patients who show me their blood work and everything's in range, but they know, and I know after my diagnosis, they got plenty of health problems. So you could have arthritis and nothing even shows up, not even inflammatory markers show up. You could have autoimmune condition and you don't even have really high white blood cell count. You could have kidney are failing and you're still in range, as I mentioned earlier with the EGFR. You could have liver problems and your bilirubin is still numbers fine. So people can have like constipation, insomnia, brain fog, chronic weight gain, poor memory, and all their blood work just looks fine. So don't think that your blood work shows that you're healthy. I always challenge people. I said, hey, you think you're healthy? You do an appointment with me. I'll tell you all your health problems. I can find health problems in a 10-year-old. That's because I'm not looking only at your blood work. It could give me clues, but mostly if you're out of range, it's probably more serious than not, because the doctor is usually just going to wait for the number to get bad. For a lot of these numbers, the doctor will just say, well, come back in 6 months. We'll see how it's doing. And another medical doctor told me what that means. That means they know it's getting worse. It's already not looking good, some number. And they just know in 6 months, it'll probably be bad enough that will justify them to be able to give you the medication, because they can't give you the medication until they get these numbers. So instead of treating you, changing your diet, just tell you, come back in 6 months and now you'll be out of range. Now they can give you the med. So it's really much more advanced conditions. Once you start having a lot of your blood work is really out of range, it's really quite advanced at that stage, because a lot of my patients have perfect blood work, maybe just low D vitamins, D or something simple, or the cholesterol's a little high, but nothing serious. But they've got plenty of health problems that they come to me with, and these are not going to be reflected in your blood work. That's why they say in India that it's the amateur that needs the blood work, but the person who has the true diagnostic skills, being able to read the eyes, the body, the tongue, the pulse, the skin, and ask a lot of questions and look at your diet, he doesn't need this blood work much, but it is helpful. Well, I hope this gave you a better understanding of the value of your lab work. And by no means this was meant to be a comprehensive course. It meant to just be, open you up to understand that, being in range in your blood work doesn't mean you're healthy. And being out of range often doesn't mean much either. It can easily be reversed with herbal treatments can improve your kidney function. Herbal treatments can improve your liver function. So, if you catch these imbalances, reflected in these numbers early enough, it's very easy to treat. Just don't wait until the numbers get really bad and the doctor's talking about kidney transplant or liver transplant, and then think that some herbalist is going to be able to help you. So the numbers should be a wake-up call if you start getting issues. Doesn't mean that numbers out of range. Doesn't mean you should just jump right into the meds, but it definitely means you should be investigating or have somebody with a little broader perspective or a holistic view on your health, review your diet, and do a full diagnostics of you. And we're not talking just some muscle testing thing. No, we're talking diagnosing and understanding what's going on and what could be causing this, say, high AST, high ALT, or high total cholesterol, and then what herbs can improve that, can liver or improve that organ so you can avoid having to take the medication. Okay, ladies and gentlemen, I hope this helped you out. Hope make you at least save your blood work, your lab work. Don't ask them for a printed copy and get it, and do some research on your own. And if you're my patient, please show me this. Send it to me in the beginning of your appointment. Thank you very much. Wish you the best of health and happiness.